In the Pacific, where several countries are already dealing with epidemics, some countries have taken extreme measures to try and halt the spread of the new coronavirus. While authorities say the risk of an outbreak remains low, little is being left to chance, especially in measles-devastated Samoa. RNZ Pacific's Jamie Tahana reports.
In the past couple of years, Pacific countries have been rattled by some of the worst outbreaks of measles, influenza, dengue or polio seen in generations. So with the coronavirus, no one's taking any chances. Jack Niedenthal is the Health Secretary in the Marshall Islands, which is currently in its 6th month of battling a dengue fever epidemic that's struck down thousands. He says the border's been effectively sealed.
That's really got us scared too. It seems to be spreading really fast from human to human. So then the only thing you can do there is check for fever at the airport, which is what we're doing already for measles. So we just feel like we're fighting a war here. It's just been awful for the last 6 months.
In Palau, charter flights from China have been cancelled, Vanuatu's formed a coronavirus task force, and a health team is stationed at Tonga's main airport. In Fiji, the Chinese ambassador said 2 residents are in self-imposed quarantine there, while the government says monitoring has been stepped up. Papua New Guinea's Health Minister, Jalta Wong, says surveillance stations have been set up, while fishing boats from China have been restricted.
We just have to be prepared and hope for the best that we contain this virus.
But the strictest measures are in Samoa, where a measles epidemic ravaged the country only a month ago, killing 83 people, most of them children. After an emergency cabinet meeting on Friday, the government imposed rules that compel anyone who's been in or transited through China to self-quarantine in a country free from coronavirus for 14 days. All travellers entering Samoa, including from New Zealand, are also required to undergo a medical examination at least 3 days before leaving. Already, people have been caught out. 6 travellers were returned to Nanda yesterday for not meeting the rules, and 2 Samoans are at Faliolo Hospital, which has been converted into a quarantine facility. A government spokesperson says Samoa's taking no chances after the measles. An epidemiologist at Otago University, Michael Baker, says while the measures are extreme, he can understand it.
Samoa has, a history where it's been devastated by past pandemics, particularly 1918 and obviously recently with measles. So I can really understand Samoan health authorities taking a very cautious approach.
The main gateway to Samoa is Auckland, from where the measles was exported last year. In New Zealand, authorities maintain that the risk of a coronavirus outbreak remains low, although limited screening began on Monday. Professor Baker says New Zealand has a responsibility to protect Pacific countries from an outbreak, which could include exit screening or even halting flights in extreme circumstances.
The need for the Pacific countries themselves to liaise with New Zealand about those measures